In this video, we will cover coronary artery disease. Coronary artery disease is a common type of heart disease. It affects the main blood vessels that supply blood to the heart, called the coronary arteries. In coronary artery disease, heart muscles will not get enough blood to function normally. There are two main coronary arteries. The left main coronary artery supplies blood to the left ventricle and left atrium, while the right coronary artery sends blood to the right ventricle, right atrium, and the sinoatrial and atrioventricular nodes. Both sides divide into smaller branches to supply blood to all parts of the heart. Plaque, a buildup of fats, cholesterol, and other substances deposit in and on the artery walls, a condition called atherosclerosis, makes the arteries narrow, which usually causes coronary artery disease. The plaques progressively enlarge, thicken, and calcify, causing a critical narrowing of the coronary artery lumen, resulting in a decrease in coronary blood flow and an inadequate supply of oxygen to the heart muscles. Atherosclerosis begins as soft deposits of fat that harden with age, often referred to as hardening of the arteries. Atherosclerosis can occur in any artery in the body. When the atheromas or fatty deposits form in the coronary arteries, the disease is called coronary artery disease. Coronary artery disease often develops over many years. Symptoms are from the lack of the blood flow to the heart. A complete blockage of blood flow can cause a heart attack. Client may not have any symptoms until he or she experiences a heart attack. That's why coronary artery disease is a silent killer. Other terms used to describe coronary artery disease are arteriosclerotic heart disease, cardiovascular heart disease, ischemic heart disease, coronary heart disease. It is also what most people mean when they use the general term heart disease. Most heart attacks are caused by coronary artery disease. Some people only discover they have coronary artery disease after they have had a heart attack. Acute coronary syndrome is an umbrella term that is used to describe many of the complications associated with coronary artery disease. These include unstable angina, non-ST elevation myocardial infarction, and ST elevation myocardial infarction. Forms or types of coronary artery disease. Coronary artery disease is in just one disease, but several different conditions. The types include stable ischemic heart disease. This is a chronic form. Coronary arteries gradually narrow over many years. Over time, the heart receives less oxygen-rich blood. In this type, blood and oxygen have to work harder than normal to flow blood to the heart. This condition can be managed with medicines that reduce the heart's workload or surgery. Person may feel some symptoms but able to live with the condition. Next is acute coronary syndrome. This is a sudden form, needs medical emergency. The plaque in coronary artery suddenly ruptures and forms a blood clot that blocks blood flow to the heart. This abrupt blockage causes a heart attack. Next is atherosclerotic coronary artery disease. Over time, a sticky, fatty substance called plaque can build up in the arteries. That makes it harder for blood to get through and raises the risk for a heart attack or stroke. Atherosclerotic coronary artery disease is when plaque builds up along the walls of the arteries to the heart. Causes of coronary artery disease. The most widely accepted cause of coronary artery disease is atherosclerosis, which is the gradual accumulation of plaque within an artery forming an atheroma. Plaque consists of lipid-filled macrophages, that is, foam cells, fibrin, a substance that helps blood clot, calcium, cellular waste products, and a plasma protein covered by a fibrous outer layer. Starting as early as childhood, plaque starts to stick to the walls lining the blood vessels. As the plaque collects along the artery walls, the arteries become narrow and stiff. It builds up over time. That makes arteries harder and narrower, called atherosclerosis. Family history affects the risk of coronary artery disease, but many other risk factors have nothing to do with genetics. The choices a person make every day add up to a big impact on the risk of coronary artery disease. Some causes of atherosclerosis and coronary artery disease are diabetes or insulin-resistant diabetes, high blood pressure, lack of exercise, smoking or tobacco use. Risk factors. There are two types of risk factors, non-modifiable risk factors and modifiable risk factors. Non-modifiable risk factors are age. Getting older increases the risk of damaged and narrower arteries. Men are generally at a greater risk of coronary artery disease. However, the risk for women increases after menopause. Women typically suffer from heart disease 10 years later than men due to the postmenopausal decrease in cardiac protective estrogen. Non-white populations have increased risk. A family history of heart disease makes more likely to get coronary artery disease. This is especially true if a parent, brother, sister, or child got heart disease at an early age. The risk is higher if father or a brother had heart disease before age 55 or if mother or a sister developed it before age 65. Modifiable risk factors. Coronary artery disease risk factors a person can control are high BP, diabetes, increased lipid levels, metabolic syndrome, obesity, physical inactivity, and tobacco use. Other possible risk factors are obstetric sleep apnea, high triglycerides, high levels of homocysteine, certain autoimmune disease, increased high sensitivity C-creatinine protein, left ventricular hypertrophy, HIV or AIDS, person who are taking too much alcohol, person who are anemic. Some risk factors that affect women in particular are preeclampsia, having eclampsia, preeclampsia or gestation diabetes while pregnant. This pregnancy complication causes high blood pressure and increased protein in the urine. It can lead to a high risk of heart disease later in life. Other pregnancy complications such as diabetes or high blood pressure during pregnancy are non-risk factors for coronary artery disease. Use of hormonal birth control pills, menopause before age 40. Women, those who are having endometriosis. Pathophysiology of coronary artery disease. Typically, coronary artery disease occurs when part of the smooth, elastic lining inside a coronary artery, the arteries that supply blood to the heart muscle, develops atherosclerosis, which is the gradual accumulation of plaque within an artery forming an atheroma. With atherosclerosis, the arteries lining become hardened, stiffened, and accumulates deposits of calcium, fatty lipids, and abnormal inflammatory cells to form a plaque. When the endothelium is injured by being exposed to low-density lipoproteins, byproducts of cigarette smoke, hypertension, hyperglycemia, infection, and increased homocysteine, hyperfibrinogenemia, and lipoprotein, an inflammatory response occurs, making the endothelium sticky and thereby attracting adhesion molecules. Over time, the plaque thickens, extends, and calcifies, causing narrowing of the lumen. Eventual hemorrhage and ulceration of the plaque may cause significant coronary obstruction. When the plaque affects blood flow in the coronary arteries, person will have coronary artery disease. In some cases, plaque can break or rupture. As a result, blood cells called platelets will try to repair the artery, forming a blood clot. Plaque can clog or damage the arteries, which limits or stops blood flow to a certain part of the body. When plaque builds up in the coronary arteries, the heart muscle can't receive enough blood. So the heart can't get the oxygen and nutrients it needs to work properly, the condition called myocardial ischemia. Without enough oxygen, the heart can become weaker. This can lead to an irregular heartbeat that is called arrhythmia. Chronic high-grade narrowing of the coronary arteries can induce transient ischemia, which leads to the induction of a ventricular arrhythmia, which may terminate into dangerous heart rhythm known as ventricular fibrillation. It leads to damage, death, and eventual scarring of the heart muscle without regrowth of heart muscle cells. Limitation of blood flow to the heart causes ischemia of the heart's muscle cells. The heart's muscle cell may die from lack of oxygen, and this is called a myocardial infarction, commonly referred to as a heart attack. Myocardial ischemia is when the heart muscle doesn't get enough blood, and it can lead to shortness of breath and chest pain. If a plaque grows so large that it stops blood flow to the heart muscle, person could have a heart attack. But most of the time, heart attacks happen from the smaller plaques that rupture. People who have plaque buildup in their coronary arteries often have buildup elsewhere in their body too. This can lead to conditions like carotid artery disease and peripheral artery disease. It can also cause heart failure, which means the heart can't pump enough blood throughout the body to meet the body's needs. If a person has limited blood flow to the arms or legs, this condition is called peripheral artery disease. When a coronary artery is completely obstructed, the condition is called chronic total occlusion. Symptoms of coronary artery disease. In the early stages, client may not have any symptoms. Sometimes symptoms only happen when the heart is beating hard, such as during exercise. As the coronary arteries continue to narrow, symptoms can get more severe or frequent. Symptoms of coronary artery disease happen when the heart doesn't get enough oxygen-rich blood. These symptoms mean the heart is pumping harder to deliver oxygen-rich blood to the body. Coronary artery disease symptoms may include chest pain called angina. The most common symptoms of coronary artery disease is angina or chest pain. Some people mistake it for heartburn or indigestion. Client may feel squeezing, pressure, heaviness, tightness, or pain in the chest. It may feel like somebody is standing on the chest. The chest pain usually affects the middle or left side of the chest. Activity or strong emotions can trigger angina. Patient may have shortness of breath. That is called dyspnea. Some people feel shortness of breath during light physical activity. Sometimes the first coronary artery disease symptom is a heart attack. A completely blocked coronary artery will cause a heart attack. Common heart attack symptoms include chest pain that may feel like pressure, tightness, squeezing, or aching pain. Pain or discomfort that spreads to the shoulder, arm, back, neck, jaw, teeth, or sometimes the upper belly. Shortness of breath, cold sweats, fatigue, heartburn, nausea, lightheadedness, or sudden dizziness. Chest pain is usually the most common symptom of heart attack. But for some people, such as women, the elderly, and those with diabetes, symptoms may seem unrelated to a heart attack. For example, they may have nausea or a very brief pain in the neck or back. Some people having a heart attack don't notice symptoms. Women often have different heart attack symptoms than men. While the most common red flag is still chest pain, women are more likely to have other symptoms such as shortness of breath, extreme fatigue, nausea, vomiting, and back or jaw pain. Now we'll see diagnosis. How to check for heart blockage at home. There is no home test that can determine whether a person has coronary artery disease, but they can check heart rate. A healthy rate is between 60 and 100 beats per minute. Blood pressure. Because high blood pressure raises the risk for heart disease, it is important to keep blood pressure in a healthy range. Stair test. If the client can't climb 4 flights of stairs within 90 seconds, that may be a sign that the heart isn't as healthy as it should be. The doctor can order many tests to get a better sense of the heart health. Electrocardiogram. This quick test checks the electrical activity of the heart. It shows how the heart is beating. Sticky patches called electrodes attach to the chest and sometimes the arms and legs. Wires connect the electrodes to a computer which prints or displays the test results. The ECG signal patterns can show if a person had or are having a heart attack. Next is echocardiogram. An echo takes pictures of the heart's valves and chambers and measures how well the heart pumps. This test uses sound waves to show blood flow through the heart. It also shows the size and shape of the structures of the heart. Sometimes an echocardiogram is done during an exercise stress test. Blood test. A sample of the blood can be checked for issues that raise the risk of coronary artery disease. They are high cholesterol, high triglycerides, and high sensitivity CRP. A high sensitivity C-creatinine protein test checks for a protein linked to inflammation of the arteries. Heart computer tomography scan. A CT scan of the heart can show calcium deposits and blockages in the heart arteries. Calcium deposits can narrow the arteries. Sometimes dye is given by IV during this test. The dye helps create detailed pictures of the heart arteries. If dye is used, the test is called CT coronary angiogram. Next is cardiac catheterization and angiogram. This test can show if the coronary arteries are narrowed or blocked. A doctor places a long, thin, flexible tube in a blood vessel, usually in the groin or wrist, and guides it to the heart. The dye is inserted through the catheter to the arteries in the heart. The dye helps the arteries show up more clearly on the images taken during the test. A cardiac angiogram, which is a type of X-ray that is taken after the heart arteries are injected with a radioactive dye to locate and measure blockages. There are two types of cardiac angiography, coronary CT angiography and left heart catheterization. Left heart catheterization is the passage of a thin flexible tube or catheter into the left side of the heart. Next is exercise stress test. These tests often involve walking on a treadmill or riding a stationary bike while the heart's activity is watched. Because exercise makes the heart pump harder and faster than it does during most daily activities, an exercise stress test can show heart conditions. A nuclear perfusion stress test uses an ECG and a radioactive tracer detected by a nuclear camera. Treatment for coronary artery disease may include medicines and surgery. Eating a nutritional diet, getting regular exercise, and not smoking can help prevent coronary artery disease and the conditions that can cause it. Treatment for coronary artery disease may include lifestyle changes such as not smoking, eating healthy, and exercise more, medicines, and heart surgery or heart procedure. Many medicines are available to treat coronary artery disease, such as cholesterol medicine. The healthcare professional might recommend this type of medicine to lower bad cholesterol and reduce plaque buildup in the arteries. Such medicines include statins, niacin, fibrates, and bile acid sequestrants. Aspirin helps thin the blood and prevent blood clots. Daily low-dose aspirin therapy may be recommended for the primary prevention of heart attack or stroke in some people. Daily use of aspirin can have serious side effects including bleeding in the stomach and intestines. Don't start taking a daily aspirin without talking to the healthcare provider. Beta blockers. These medicines slow the heartbeat and lower blood pressure. If a person had a heart attack, beta blockers may reduce the risk of future heart attacks. Calcium channel blockers. One of these medicines may be suggested if the person can't take beta blockers or beta blockers don't work. Calcium channel blockers can help reduce chest pain. Angiotensin converting enzyme inhibitors and angiotensin 2 receptor blockers. These medicines lower blood pressure. They may help keep coronary artery disease from getting worse. Nitroglycerin. These medicines widens the heart arteries. It can help control or reduce chest pain. Nitroglycerin is available as a pill, spray, or patch. Ranolazine. This medicine may help people with long-term chest pain. It may be prescribed with or instead of beta blocker. Surgeries or other procedures. Surgery may be done to fix a blocked artery and improve blood flow. Some of the most commonly performed procedures for coronary artery disease include coronary angioplasty and stent placement. These procedures can open blocked or narrower arteries without opening up the chest. In angioplasty, a doctor threads a thin flexible tube called a catheter with a balloon through the blood vessels until it reaches the blocked artery. The doctor then inflates the balloon, which stretches the artery open so more blood can flow. A small wire mesh tube called a stent may be placed to keep the artery open. Most stents are coated with medicine that helps keep the artery open. This treatment also called a percutaneous coronary intervention. Client typically be in and out of the hospital in a day. Next surgery is coronary artery bypass graft surgery. This is a type of open heart surgery. During CABG, a surgeon takes a vein or artery from somewhere else in the body. The surgeon uses the blood vessel to create a new path for blood to go around a blocker or narrower artery. Cardiac rehabilitation and recovery. After a heart attack or cardiac surgery, the doctor will likely recommend that to complete a cardiac rehab program to help recover. Cardiac rehab will start while in the hospital, then can attend outpatient appointments once after going home. Typically, these programs include the following: exercise training, addressing cardiac risk factors, heart health education, nutritional guidance, emotional support. Studies have shown that cardiac rehab can help lower the future risk of stroke, heart attack, depression, and cardiac-related death. Prevention of coronary artery disease. Fortunately, there are a number of things a person can do to reduce the chances of getting coronary artery disease. It is important to manage high cholesterol, high blood pressure, and diabetes. Keep a healthy weight. Avoid cigarette smoke. Limit the alcohol. Eat whole foods and avoid trans fat. Get plenty of fiber-rich foods such as fruits and veggies, whole grains and beans. Limit salt and aim to have 2 servings of fatty fish such as salmon, tuna or mackerel a week. They are high in heart-healthy omega-3 fats. Exercise regularly. Manage the stress level. Complications. Coronary artery disease can lead to other serious and sometimes life-threatening conditions such as angina. Angina is a symptom of coronary artery disease, but it also can be a complication of worsening coronary artery disease. The chest pain happens when arteries narrow and the heart doesn't get enough blood. Arrhythmias. If the heart isn't getting enough blood, it may start to beat irregularly. Some types of arrhythmias can be life-threatening. Arrhythmias are abnormal heart rhythms like atrial fibrillation. Heart failure. This is when the heart can't pump enough blood. Heart attack. This is the most common complication of coronary artery disease. Heart attacks occur when a piece of cholesterol breaks off and causes a blood clot that blocks blood flow to the heart. Over the years, coronary artery disease can also weaken the heart and lead to complications including cardiac arrest and cardiogenic shock.